My name is Sarah. I'm a licensed clinical social worker. I started my journey in education at Plattsburgh State University in Plattsburgh, New York. I received a bachelor's degree of science in human development and family relations, and then I also minored in psychology. I decided to take a year off in between going from getting my bachelor's to then pursuing my master's degree. I chose to go into social work for my master's program. I did that at Albany, in Albany, New York. I focused on the micro program, which is more clinical therapy, and then was considering a macro program, but decided to go into the micro because I knew I wanted to work one-on-one with people and families. Prior to joining Community Health Center, I was working at Canton Hospital in the inpatient rehab program. I was there for 4 years. Throughout that time, I worked with individuals with all types of mental health as well as substance abuse disorders. I think I became passionate about mental health and human behavior specifically very, very young. I was always fascinated by people's decisions and why they did the things that they did, why people thought the way they thought, spoke the way they spoke. And I was also very observant as a child too, very empathetic, observant, and I would see how different environments impacted people. I took care of my grandmother. She had a stroke in her 50s, and that impacted her cognitive functioning, her social emotional health. And I think taking care of her made me realize that people's brains can change. And then I had this phenomenal experience. I was part of the Allied Health program, the BOCES Allied Health program. I attended the Norwood building, and we went to the cadaver lab at Clarkson, and I got to hold a human brain. And I think feeling the human brain and just realizing that there's so much power and an experience, so many experiences within just that was a person, and they had feelings, and they had opportunities, and they had love, and they had anger, and they had all those things. It's just in one thing in my hands, and it's squishy, and it's weird looking, and that experience was very transformative. So I decided to put a portfolio together based on my allied health experience. I presented it to the psychology department at Plattsburgh, and I was accepted right away. I would have to say that's a really hard question to answer, but one of my most rewarding experiences where I felt most fulfilled, I love to teach. I love psychoeducation. I think there's a lot of great benefits that come from teaching people about their brain, about behavior. So my motto is know better, do better, or at least try. And if people know what's going on with their mental health, there's more autonomy and agency for them to change that. People don't come to therapy. People will come to therapy, I think, thinking that the therapist is going to heal them, but that is not true. It's the therapist that becomes the teacher, that becomes the extended soundboard, that allows the person to see the potential that they have in themselves, so then they can change themselves. And when I was teaching psychoeducation groups at Canton Hospital at the rehab, I just was amazed by when someone learns a concept, how much power and control they learn about themselves and how much more motivated they are intrinsically to change based off of basic education on psychology and behavior. It's fascinating. So I used that in addition to sound therapy. So I started taking education and then the power of sound frequency, and I became certified in integral sound therapy with tuning forks. And I began to integrate therapy, psychotherapy with sound healing. And I think the process and the journey I've had with psychoeducation, and then the journey that I'm finding with sound healing and combining the two services together has become very powerful. So previously in the past, I've worked with 18 and older, so adults. At the rehab, that was the standard. Here, which is very exciting and I'm looking forward to, is I get to work with the younger population. So I believe the cutoff is 10 years old. So I see a couple 10-year-olds, I see quite a few adolescents, and then I also work with the older adults as well. A new client coming to the Community Health Center to see me can expect open dialogue. I do, and I believe in talk therapy, narrative therapy, rewriting your script. Just because you experienced trauma in the past, I'm not going to invalidate that. I will validate your experience. However, I want to empower you, and I want you to find that motivation within yourself to be able to see a brighter future, so that way you can be healthier, but not just you. I'm looking towards family, collective health, community health, and it starts with the individual in the chair. So you can expect motivational interviewing, cognitive behavioral therapy techniques, dialectical behavioral therapy techniques, ACT, which is acceptance and commitment therapy, person-centered approaches, trauma-informed approaches to therapy. I really believe that each person coming in here, so we say person-centered. What does that mean? Person-centered means it's based on your lived experiences, your environment, the ecosystem in which you reside in, the challenges you've faced, your personal strengths, so very strengths-based approach. And I also kind of put in a little analysis from my own perspective, picking out patterns for people, inviting them to start looking at their own patterns. And I kind of cluster that up with a bow, and there's therapy. So the people who are ambivalent about reaching out for services, I would recommend and suggest and encourage them to take a risk. And people are used to taking unhealthy risks in their life. We know what that feels like. There's a lot of consequences that typically come with the unhealthy risks we take. But I want to encourage people to take a healthy risk, which requires you to get out of your comfort zone and try something different. And I really believe in the human intuition. I think that a lot of us know what we need, but it's just getting out there and trying something that we've never done before. That can be really scary. So I would encourage people to take a healthy risk, follow your intuition, and always ask for help. Sara outside the health center, I am adventurous, but I'm also a person who enjoys solitude. I love my home, I love my garden, I have goats. Goose has 2 girl goats, and we have cats, I have a horse, I'm a big horseback rider. I like to be outside with my husband. I like to travel. I love hosting. I love people coming and gathering at my home. That's very special to me. My husband and I have put a lot of love and energy and intentional energy into our home. So we always have projects and renovations going on, but we're almost there. So yeah, I love spending time with family. I love animals. I also like to do this on the side, my sound healing on the side. I have lots of hobbies, a lot of really great and supportive friends and family that allow me to do that. Goosey Girl! Oh yes, Goosey Girl. So Goosey Girl is 7 years old. She just turned 7 in December. We adopted her off of Pet Finder. She is an American cattle dog. We got her through the American Cattle Dog Association. Goose is a Blue Heeler Catahoula mix. And if you know anything about Catahoulas, they're big babies. Very smart breed of dog. Intuitive. Come here. She's a hard worker. She wants to work. She knows the word work. We go to work. She knows lots of words. But yeah, Goose is a Blue Heeler, Catahoula. She's 7, and she is a registered Canine Good Citizen through the American Kennel Club. And she's been coming to work with me for about four years now. I was working at Canton Potsdam Hospital, and there was a couple other people that had therapy dogs, emotional support dogs, CGCs, and I was really intrigued. I thought Goose's temperament would be perfect for the job. She's fun, she's silly, she's playful, and she passed her test with flying colors. She passed her temperament test, and she's a fast learner too, so it's not hard to teach her tricks. she passed all of her tests, and I brought her into the rehab for the first time, and she walked in like she owned the place. She walked in like she'd been there for a really long time, and the patients really enjoyed her. A lot of interactive one-on-one, throwing her the ball. We would go for walks as a unit, and Goose always came on walks with us. I would do one-to-one like talk therapy sessions with, we call them walk and talks, and Goose would come on those, and the patients really loved her. So I figured when I was coming over to the community health center, well, we could use this here too. And it's been great so far. She's been very patient with people. Come here. Come here. Come. No. She's also very bashful. She's very shy. Has lots of personality, which you can see in her ears. She's very expressive with her face and with her ears. Yeah, you are. She's a really good girl. And so far, my patients have loved her here. So I was talking earlier about intuition. She is reading human behavior better than any of us. She knows when my patients are getting sad or when an emotion is coming. She can feel it before it's even visibly present. And I think that's very fascinating about a lot of animals, but specifically dogs in this field. They can gauge that a lot faster than I can. So she's actually helping cue me when a patient's about to feel something. I might not see it right away. I think I'm pretty good at picking those things up, but if Goose goes over to them and kind of backs her back into them and they start petting her, that's a sure sign for me that I know that they might not be telling me that they're feeling stressed, but I know when she does that they're stressed.